So all about hepatitis B in community medicine point of view. Okay, so let's begin. So I'm also a final year going student who's preparing for a university third year university exam. So let's learn together. Okay, we are just learning together. I am not someone who's explaining this to as a professor. I'm not making this video. I'm just making it as a making that I'm making it this video such that it will be helpful even for myself how for memorizing and revising. So don't expect me to explain it very crystal clear. Okay, just learn accordingly. It might be useful for your passive learning. So let's begin. Thank you. Let's begin. Hepatitis B. Hepatitis B, formerly known as serum hepatitis, is an acute systemic infection with major pathology in the liver caused by hepatitis B virus. Hepatitis B is a viral infection that attacks the liver and causes inflammation of the liver, resulting in both acute and chronic disease. Let's see epidemiological determinants. Age and factors. Agent. Hepatitis B is a complex 42 nanometer double shelled DNA virus originally known as DANE particles. HBV, that is hepatitis B virus, occurs in three morphological forms in the serum of a patient. The one is small spherical particle, which is about 22 nanometer, tubules of varying length and diameter, and DANE particles. DANE particles are known to be infectious. Okay, as because this one contains why DANE particles are meant to be infectious, because these DANE particles contain the genetic material, so such that they can replicate and they can multiply as much as they can. Reservoir of infection. Human is the only reservoir of hepatitis B virus. The persistent carrier state has been defined as the presence of HBsAg, that is hepatitis B S antigen, with or without concurrent HBeAg for more than 6 months. So let me explain this sentence. Like, human is the only reservoir of hepatitis B virus. Hope this one is clear. Persistent carrier state has been defined that when a serum collected from a person has hepatitis HBsAg antigen with or without HBeAg antigen for more than 6 months, they are said to be persistent carrier. Infected materials. Blood, main source of infection. Body secretions like saliva, vaginal secretions, and semen of infected persons. So these are the various infected materials which this virus can get transmitted. Resistance. Virus is quite stable and capable of surviving at least 7 days on an environmental surface. So, okay, it's quite stable because of its complex structure. It contains spherical particle, tubules of varying length and diameter, and DANE particles. Tubules are, I think it's microtubules made up of protein material, I guess. Not sure. Period of communicability. It is usually several months, occasionally in years in chronic carriers, until disappearance of HBsAg and appearance of surface antibody. So until this antigen disappears, the person is said to be the disease or the virus can get transmitted. Okay. Host factors. Age. Outcome of HBV infection depend upon age. Okay. Newborn are highly prone to develop chronic HBV infection. Adults show comparatively very low probability of probability of development of chronic HBV infections. So newborns are more likely to develop chronic HBV infections, whereas adults are not like that. High risk groups. This includes surgeons, physicians, recipients of blood transfusions, healthcare, laboratory personnel, homosexual, prostitutes, drug abuser, infants of HBV carrier, infants of HBV carrier mother, and patients who are immunocompromised. And hepatitis B and HIV infections. Presence of HIV markedly increases the risk of developing HBV associated liver cirrhosis and hepatocellular carcinoma. Modes of transmission. Parenteral route. It is transmitted by infected blood and blood products through transfusion, dialysis, contaminated syringes and needles, handling of infected blood, and accident inoculation during surgical and dental procedures. Okay, perinatal transmission. Hepatitis B is most commonly spread from mother to child at birth as a result of leak of maternal blood into the baby's circulation or ingestion of or accidental inoculation of blood. Sexual transmission and other routes. It can spread through physical contact between children with skin conditions such as cuts or grazes. Incubation period. It varies from 30 to 180. 1 minute. It varies from 30 to 180 days. Average incubation period is about 75 days. Clinical spectrum. Symptoms include yellowish discoloration of the skin and eyes, jaundice, dark urine, dark urine, extreme fatigue, weakness, tiredness, nausea, vomiting, and abdominal pain. Small group of suffering persons with acute hepatitis can develop acute liver failure. This can lead to loss of life. Okay. HBV can cause chronic liver infection, which can later lead to development of cirrhosis of the liver or carcinoma of the liver. Diagnosis. Common serological pattern in hepatitis B virus infection and their interpretations. Okay. Okay, fine. So this is the most important part and it's little difficult to understand. So let's study this. Let's make it simple. Okay. See, first let's understand the serum markers. HBsAg antigen, anti-HBs, if it is this is antigen, this is antibody. Okay. And anti-HBc antibody of HBc antigen. HBc antigen cannot be seen in the serum, but antibody to HBC can be seen. And HBe antigen and anti-HB. Hope this one is clear. Okay, it's a bit logical. If you see the antigen, you can see the corresponding antibody. This antibody will be there, HBC, but you cannot see its corresponding antigen because it's known as C stands for core. Core antigen won't be present, but core antibody will be present. Okay. So interpretations. Come on, let's see. See, now see, this is the blood and virus is entering the blood. Okay. Now at the first thing first, HBsAg antigen will be found in the serum, but immediately we cannot see its antibody, and but HBc antibody will be secreted before HBs antibody. IgM will be present. Okay. Next, HBe antigen also will be seen, but its antibody won't be seen. The only antibody will be seen at the beginning is HBc antibody. then it is acute hepatitis B. Okay, understand this, and based on this, let's see the remaining. Still, HBS antigen is found. Still, its antibody is not found, and this IgM gets converted to IgG, and HBE antigen is present, and it's again still anti-HBE is not found. Since this IgM gets becomes IgG, this becomes chronic hepatitis B with active viral replication. Because why active viral replication? Because still the antigens are present in the blood serum. Next, again the same. The only thing is anti-HBE HBE antibody is present. So this means chronic hepatitis B with low viral replication. Next, what changes? Now these antibodies, HBS antibody starts to appear, and this may or may not present, and this one may or may not present. So it's chronic hepatitis B with heterotypic anti-HBS, about 10% of cases. Again, these both gets absent, becomes these both disappears. Now this one changes to no, this one is another new case. Okay, this is also one of the findings. If this becomes, if this may or may not, okay, this again acute hepatitis B. So acute hepatitis B can be like this or like this. Recovery from hepatitis B, how can we find? This one, these two antigens are absent, but the antibodies are present. It's a good sign. Then vaccination immunity. Only antibody of HBS antigen is present. False positive less commonly in infection remote past. Okay. Now let's understand this graph. So infected about 4 weeks. The incubation period on average it is about 75 days, but let's take it for 4 weeks. HBS starts to appear. What happens? Let us consider only these 4 rows: acute hepatitis B, chronic, chronic, chronic. Okay. Now what happens is that HBS starts to appear. Yes, it starts to appear. Next, what else is present? And yes, HBV DNA. Wait a minute. Yeah, total anti-HBS, anti-HBC is HBC antibody is also present. It also starts to appear, and HBE antigen is also will also start to appear. Okay, so these 3 things are there. And here they have mentioned HBV DNA. So okay, let's just see. Then what happens when it becomes chronic? Still HBS starts to will be rising. This one is also present. Both IgM, IgG they have considered. Then what else? HB, then yeah, HBE also is present. So okay, then what happens? Still there. This one HBS, HBE, AG is still there. IgG is still there. Then which one newly starts to appear is that this one. This anti-HBE starts to appear. So what happens? Anti-HBE, yes, this one starts to appear here. So at this point, this one anti-HBC antibody becomes IgG, and HBeAg also is present, and yeah, that's all. Then the the graph, I think the graph is almost over, but here anti HBS is present here, and they have given what. We are still here, right? Okay, then. Okay, we are still here. Now we are coming here. We are here, and yeah, here. So yeah, so this much of understanding, I think it's more than enough. Let's move on to next. Move on. Let's move on. Moving on is very important in life also. HBsAg antigen, surface antigen, also known as Australia antigen, first antigen to appear in serum. Epidemiological marker of it's an epidemiological marker of hepatitis B infection. HBcAg, core antigen, alone does not appear in serum. We have never seen HBcAg. Okay, HBeAg, hepatitis B envelope replication, indicate active viral replication, marker of infectivity for hepatitis B. See, they have seen marker of infectivity for hepatitis B. What does it mean? So, HBeAg antigen will decide the prognosis. Based on this HBeAg antigen only, we'll be assessing the level of treatment, whether the treatment is going good or not. Okay, hope this one is crystal clear. And anti-HBC, antibody to HB and hepatitis B core antigen, first antibody to appear in serum. Yeah, as these thing everything we have discussed, now we are seeing it in the form of words. IgM indicates a diagnosis of acute hepatitis B. Anti-HB antibody to envelope antigen indicate end of period infectivity. I think this one signals. I think this one, like 1 minute. And when does this anti-HB appears? Anti-HB appears. Yeah, this one. Yeah, from here it appears. From here it appears. So yes. Now anti-HB is antibody to surface antigen signals end of period of communicability. Okay. So when anti-HBs appears, the transmission does not occur. Prevention and containment. Hepatitis B vaccine. So when it comes to community medicine point of view, we are more interested in prevention and containment. Okay, that is vaccines. Vaccines for hepatitis B. It is of two types: plasma derived vaccine, RNA, DNA, rDNA. Sorry, not RNA, rDNA. That is recombinant DNA yeast derived vaccine. Okay. Now, formalin inactivated subunit based on HBsAg derived from carriers of hepatitis B. This is based on the genetic material. This is based on the antigen material. Okay. Hepatitis B vaccine is available as monovalent formulation or fixed combination with other vaccine such as pentavalent vaccine. When immunizing against hepatitis B at birth, only monovalent hepatitis B vaccine should be used. Very important point. At birth, only monovalent has to be used. Immunization, children, adult above 20 years. So it is of two types: a monovalent hepatitis B, pentavalent, that is DPT hepatitis B, and just a second, let me see what is HIV. Haemophilus influenza type B. Yes, Haemophilus influenza type B vaccine. Dose 0.5 ml, 0.5 ml, intramuscular, schedule 6 and 14 or 6, 10, 14. Schedule 6, 10, 14. Now coming to adult, 1 ml intramuscular, 0, 1, 6 months minimum interval. Between first and second dose is 4 weeks. Third and third dose is given 4 to 6 months after second dose. High risk person for whom vaccination is recommended are contacts of HBsAg positive persons, injecting drug users, healthcare workers, recipient of organ transplantation, person who frequently require blood or blood products. Hepatitis B, HBIg, hepatitis B immunoglobulin. Required for immediate protection for those acutely exposed to HBsAg positive blood, for example, surgeons, nurses, laboratory workers, newborn infants, of carrier mothers, sexual contacts of acute hepatitis B patients, etc. That is 0.05 to 0.07 ml per kg, 2 doses given 30 days apart. HBIg provides short term passive protection which lasts approximately 3 months. Treatment for cases. There is no specific treatment for acute hepatitis B. Care is aimed at maintaining comfort and adequate nutrition balance, including replacement of fluids, loss from vomiting and diarrhea. The key interventions of global sector strategy for viral hepatitis is from 2016 to 2021 are treatment intervention, prevention intervention, diagnosis of HBV and HCV, treatment for HBV and HCV, 3-dose hepatitis B vaccine for infant, prevention of mother to child transmission, blood safety and injection safety, harm reduction for a person who use drug. Those the WHO 5 C's, these are principles of hepatitis B, hepatitis testing, consent, confidentiality, correct test results, counseling, connection. So these 5 C's has to be followed when the person for screening hepatitis B. What else? Everything is clear now. I think, you think, I don't know. 3-dose hepatitis B vaccine for infants, prevention of mother to child transmission, blood safety, injection safety. So this is very important for our doctors and nurses. If blood safety and injection safety has to be followed. Harm reduction for person who use drug. Okay then, thank you.